Our second child, my daughter, was born severely premature. So she was born about 8 weeks early and spent over a month in the intensive care unit. And it's interesting in that situation, having been a physician who'd spent time working in intensive care units for newborn babies, going up to visit your own child several times a day and spending time with her to see the impact not only on her but on the other moms and dads who are seeing their children as well. In the United States, approximately 1 out of 10 babies are born prematurely. Statistics are only numbers until it's your patients, then it's personal. As obstetricians, we're not very good at predicting, so we basically consider every woman at risk for a premature birth. When I explain to my patients the rationale for doing certain testing, I try to look for analogies that they could relate to in their everyday life. So things as simple as a pap smear. We do pap smears to look for people who are at higher risk for getting cervical cancer. Every day we fly, we go through a metal detector for looking for people who are at higher risk for potentially causing harm to other individuals. And so these kinds of tests allow us and empower us to look at people who are at higher risk versus people who are at lower risk. I believe that the preterm test is important because it's giving us the ability to look for women that we would not have been able to predict or at high risk for having a premature delivery. The preterm test is a blood test that is done early in pregnancy that allows us to measure two proteins that in certain ratios have been shown to differentiate which women are at much higher risk than the general population for delivering prematurely. When we see somebody who has a high-risk result, we would watch that person more closely than we would have otherwise. We would measure the cervical length, we would do more ultrasounds, we would be a little bit more sensitive to minimal alterations in what they're feeling. With 1 in 10 women in America delivering prematurely, I think every woman is an excellent candidate for the preterm test.